right, we're going to talk about Medicare Parts A and Part B. But what we're going to do is we're going to do a progression of Medicare, how it works in conjunction with the Medigap policy, also commonly known as Medicare supplemental insurance, and also showing the transition to a Part D drug plan, but then also following it up with a side-by-side comparison of a Medicare Advantage, also commonly known as Part C. So you'll see this progression on the whiteboard as we move forward, and I think it'll help kind of make sense. We've seen over the years people seeing this kind of the progression of it side by side versus a slideshow has worked out really well for people to help them to understand kind of how the different insurance policies in Medicare work. So first we're going to start with Medicare Part A. Now, as you can see here, Medicare Part A covers the hospital, skilled nursing, and hospice. Now, Part A is provided to you or an individual based upon the number of years that they've worked. So this does, for most people, come at no cost on a per monthly basis. So if you've met that minimum requirement of working 40 quarters over the course of your lifetime, Part A is provided to you by CMS at no additional monthly cost to you. Now, Part A, outside of covering inpatient hospitalization stay, skilled nursing, hospice, Part A has a deductible, and that's not per year, but per benefit period, which always leads to the question, what's a benefit period? Well, benefit period starts over every 60 days. I'm going to use a couple examples to help this kind of make sense. So a benefit period, as we indicated, starts over every 60 days. So first example I'm going to use, let's say an individual were to end in the hospital, let's say January 1st, the beginning of the year. It could be for a variety of reasons, stroke, heart attack, maybe a slip and fall. So that person enters in the hospital. They're responsible for the deductible. Now, naturally, that would only be if the cost for services rendered exceeded that deductible. So you pay this deductible. You've met it for that benefit period of 60 days. So you can go in and outside of the hospital during that benefit period. You're no longer responsible for that deductible. However, let's say you go in the hospital for 3 days, you get discharged. You're now out 60 days. You go back into the hospital for may could be complications for the reason that you were there back on January the 1st or something entirely different. You've now entered into a new benefit period, which at that time, you then be responsible for that deductible again. So it's not a calendar year deductible. Again, the emphasis here is for you to understand it's a benefit period, which that benefit period starts over every 60 days. So worst case scenario, if you're to take 12 months, divide that by 60 days, you would have potentially 6 times per year you could be hypothetically exposed to that deductible. Okay, so I'll make that very clear. Most people aren't aware of that. Now, the second example I want to use in this illustration would be, let's say you're someone who enters in the hospital, stroke or heart attack January 1st. The symptoms or the complications from that stroke or heart attack, you're not progressing in a manner that would allow you or the doctors felt comfortable to send you home. So you have continuous days inside the hospital. Now, you're there in the hospital for days 1 through 60. There's no additional cost to you outside of the $1,736 under Medicare Part A. But if you're there on day 61 through 90, then they start charging you a co-insurance or copay, $434 per day, up to day 90. On day 91, if you're still there, days 91 through 150, it increases up to $868 per day. Once you reach day 151 and beyond, you then are responsible for 100% of the cost for those services rendered under Medicare Part A. So what we're establishing here is you'll see this progression is why a person we would suggest having either a Medigap policy or Medicare Advantage to help cover those costs in something catastrophic or a critical or terminal illness diagnosis. So outside of the deductible and the copays for Part A, you also need to be aware of that your first 3 pints of blood are not covered by Medicare Part A. This cost, and this is a cost that was provided by Trinity Healthcare System a few years ago, So to be honest with you, I'm not sure what the up-to-date cost is, but this is what it was just a few years ago. Per pint, depending on the blood type, ranges between $1,500 up to $4,000 that you potentially be responsible for. So again, this is just Medicare Part A. And again, in summary, Part A is provided to you as long as you've met the minimum requirements of working 40 quarters during your lifetime. Now, if you were a stay-at-home wife, or I guess husband, your spouse can meet that requirement for you if they've worked, for 10, 20, 30, 40 years while you were married. Okay. Now, let's move on to Medicare Part B. Now, under Medicare Part B, this is medical. So, what I want you to think of under Part B, these are all the services that are rendered by the physicians, the PA, the nurses, and up with inside of the actual facility, whether it be an outpatient, doctor's office, or hospital. So think of durable medical equipment. Think of oxygen, prosthetics, x-rays, MRIs, EKGs, PET scans. Those are some examples that are going to fall underneath Medicare Part B. Think of doctors, whether it be a primary care doctor or a specialist, and again, those services. So if you went to, let's say, for example, a physical therapist, those services that are being rendered with inside of the PT office or the occupational therapy, that's going to fall underneath Medicare Part B. Medications. Medications that are only administered during a hospital stay, a doctor's office visit. So if you receive an injection of some kind, or maybe it was an antibiotic through a syringe, or an IV during a hospital stay or emergency room visit, urgent care visit, that's all going to fall under Medicare Part B. Now, Part B has its own deductible, and this deductible is $283, and this is per year, not a benefit period, again, per year. So if this deductible is met in January or February, you no longer have any other deductibles. Now, Part B does have an 80-20 co-insurance. So after you meet your deductibles, you are responsible for 20% for Part B services. One variable, or what I want message I want to make clear, is that there is no cap in co-insurance charges. So if you have an individual plan, if you're self-employed, or you have a program through your employer, your spouse's employer, those plans have what's called a max out of pocket. So they can only charge you so much within inside a calendar year, that's a combination of your deductible and the co-insurance. Once you reach that max out of pocket threshold ceiling, everything's covered 100%. With Medicare, you're responsible for 20% no matter the cost. Now, when you go on Medicare Part B, there is a cost directly associated with it. That cost is a direct reflection of what you show in income. Being that we're in 2026, that income is going to be a reflection of what you showed in income in 2024. Now, we're going to provide you another video. It's going to give you some direct contacts into different variables and circumstances that may, if you retired or you're planning to retire, and how that can be justified. But if you are actively retired, it is going to be a direct correlation to what your income was in 2024. And so there's 6 different levels to what that dollar amount is. The base amount is $202.90. And that's per month. Now, again, that baseline is a direct reflection of your income. So if in 2024, if your income was $219,000 adjusted gross income, and again, that adjusted gross means that all your deductions, so you've netted below the $219,000, then your baseline for a joint married couple is $202.90. If you're single, your adjusted gross income is $109, and then it would be a $202.90 on a per monthly basis. Now, the premium deduction out of your Social Security check, that would change if you're not collecting a check. So for those that are deferring their Social Security check down the road, the future, then what they would do is they would bill you quarterly for that dollar amount. And then we'll have another video that will show you that shows what those different levels are in terms of income. Now, when you go on Medicare, Medicare goes into effect the first day of the month that you turn 65. That's if your birthday falls on the 2nd or thereafter. If your birthday falls on the 1st of the month, then it would be the previous month. So for example, if your birthday fell on June 1st, your Parts A and Part B would begin May 1st. When you go on Medicare, Medicare becomes the primary. Now, it would only be the primary if you're not receiving group health care benefits, and there has to be greater than 20 employees or more. If you're retired, not in a group health insurance plan, then Medicare becomes the primary. And then what we'll talk about next is what's called a Medigap, or commonly known as the Medicare supplement. So if you hear the term Medigap or Medicare supplement, just know that they're the exact same policy. This becomes the secondary to Medicare. So Medicare, Medigap, or Medicare supplemental insurance. I'm going to continuously repeat Medigap, Medicare supplemental insurance, so just to kind of pound it into your mind so they mean the same thing. Because sometimes people don't understand the terminology between Medicare Advantage, Medigap policy, supplemental insurance. So I just want to make that very clear to you. So again, Medicare is a primary. Medigap / supplement becomes the secondary to Medicare. Whatever Medicare approves, the supplement has to pay. Now, in the United States, there's 10 plans the federal government designed and created for the private insurance carriers, and they're administered through the insurance carriers to present to you as an option to choose from. In today's video, we're going to talk specifically about Plan G. Now, for anybody that went on Medicare after January 1st of 2020, Plan G is the most comprehensive plan on the market. It's also the most popular for the reason I just mentioned, because it's the most comprehensive on paper. So it doesn't matter where you purchase that plan through, meaning the insurance provider. Plan G is the most comprehensive health insurance you can get, whether you're someone who's 65, 70, or even if you're someone who's 50 years old or you're in your 20s. Plan G is the most comprehensive. So when we look at the exposures that you have here in Part A and Part B, depending on the plan you choose, is going to determine how much of this is covered. Now, being that we're talking about Plan G, as in Gary, G is going to cover everything under this column here, 100%. So this is going to cover your Part A deductible, 100%. It's going to cover Part A copays, 100%. It's going to cover Part B co-insurance, the 20%, 100%. The only thing that Medigap Plan G does not cover, it doesn't cover your Part B deductible of $283. So once that deductible is met and you have a Plan G, everything then is covered 100%. Now, outside of Plan G, the purpose of this is just to cover doctors, hospitalization, urgent care, emergency room, and any medications that are administered during a hospital stay. So it doesn't cover prescribed medications, doesn't cover nursing home, doesn't cover assisted living. So again, strictly Medigap / supplement. There are 10 plans to choose from. Again, Plan G is the number one choice amongst the senior community across the United States for the simple fact, again, it's the most comprehensive. So in summary, Medicare is your primary, Parts A and Part B. In order to get a Medigap, Medicare supplemental insurance, you have to have Parts A and Part B as a requirement. The Medigap becomes a secondary to Medicare. Once Medicare approves, the Medigap carrier will then pay their portion of responsibility based upon Plan G. And as we indicated here, it covers your Part A deductible, Part A co-pays, and it covers your Part B co-insurance. What it doesn't cover is your RX coverage, nursing home or assisted living, and then it doesn't cover your Part B deductible. Now, let's talk about RX coverage. Part D. Now, every state is different in terms of the plans they offer, but here in the state of Michigan specifically, there's 13 plans to choose from. Now, there's 5 variables or factors that we have to ultimately take in consideration to identify what specific plan is going to cover your prescribed medications. 1, what is your zip code? The purpose of the zip code is to verify all the pharmacies within a close proximity to your home, and we can verify whether it's an in-network, out-of-network, or a preferred network pharmacy. 2, we want to know the name of the medication. So if you're taking a name brand, say for example, Lipitor, but it's actually determined that you're actually taking the generic, we want to know the generic version, not the name brand, because that's going to have a direct reflection of your cost. 3, what is the dosage amount? Is it 20, 40, 60 milligrams? If you're taking insulin, we want to know the units per injection. If it's an inhaler, we want to know the percentage, the size of the actual inhaler itself. And then 4, what is the frequency of use? Once a day, twice a day? Is it as needed? Is it a seasonal medication? We want to know the frequency of use. And then last, the frequency of refill. Again, this could be once a month, once every 2 months, every 6 months. Some people take a medication and they fill it once a year. It could be a seasonal medication. As long as this information, these 5 variables or factors are provided and are accurate, what this is going to do is it's going to put in order from 1 to 13 which drug plan is going to maximize your savings for that calendar year. Now, there's different levels to the Part D drug plan. So you have the initial deductible, and then you have the coverage, and then you have the catastrophic phase. So some drug plans, most of them have a deductible. So here in 2026, there's a $615 deductible. That deductible is only applicable to tier 3 or tier 4 medications. So you would have to meet that deductible first before then that plan or for that drug specific tier 3 or tier 4 medication, you would then just pay its copay. Now for 2026, there's a cap of $2,100. So once you've paid $2,100 in copays, then you've met the max. So anything beyond that, $2,100 is then covered 100%. So in summary, again, going back, you got Medicare as your primary. You have your Medigap that's to cover the exposures within inside of Part A and Part B. The Part D drug plan is designed to cover those specific prescribed medications. And this would be a separate card as well. And again, the requirement to enroll in both a Medigap and a standalone drug plan, you have to have Parts A and Part B. So this next phase, we're going to talk about Part C/Advantage. And I apologize for my scribble. So if you hear the term or the terminology Part C or Medicare Advantage, just know it's the same thing. Again, it's our government working in our best interest, just trying to create more confusion by naming the same thing with 2 different names. So essentially what a Medicare Advantage is taking these 4 columns, condensing them into one plan. So whereas you have Medicare as your primary, and then you have your Medigap as your secondary, the Medicare Advantage is going to act as both the primary, but also as the secondary. So one way to identify what a Medicare Advantage is compared to a Medigap, differentiator like marketing material, is one, Medigap policy is there's no networks. So you fall underneath the federal level because CMS standardized these plans. So every healthcare system across the United States has to accept original Medicare. So, and this follows the rules set by CMS and Medicare. So every healthcare system is in network. When you go on a Medicare Advantage, you're adjusting to a network plan. So it's going to go to an HMO POS, or a PPO. So any marketing material is going to specify HMO POS, or a PPO when we're looking at a Medicare Advantage. Whereas a Medigap, the plans are all going to be identified by a letter. So Plan A, Plan B, G, C, F, K, L, M, and N. Those are the 10 plans. So here you have a network. Now, Medicare Advantage, depending on the state, the county you live in, you could have 30-some plans to choose from to over 100 plans to choose from, depending on between the three networks. Now, Medicare Advantage, what people find attractive or they're drawn to is most plans don't have a monthly premium. Whereas a Medigap Plan G, the premiums are based upon your zip code. So they all have a premium. Some plans are going to have deductibles. They're going to have co-pays for doctors, office visits, urgent care, emergency room, hospitalization, all those services rendered within inside of a doctor's office visit or a hospital stay, or again, urgent care or emergency room visit. Medicare Advantage plans have what's called a max out of pocket, which is just like if you're someone who is self-employed, you provide your own health insurance, or you have your participant group employer plan. They all have a max out of pocket. So these are almost identical to an individual or a group sponsored plan. Max out of pockets, I'm going to give you a range, are from $3,400. You can go up to about $9,200, depending on the county and the state that you reside in. So you could have this range, and typically the lower the max out of pocket is a direct reflection that's typically it's an HMO. Most PPOs you're going to find in the middle, to the higher side, depending on the county or the state that you reside in. The way that this works is the max out of pockets gives you a ceiling, so that way you have an indicator as to what's the worst I could pay out of pocket in a calendar year if I were to be hospitalized or had an urgent care visit or emergency room visit, or maybe just you have chronic health issues and you're consistently doctoring. So the way it works is that with inside of Medicare Advantage plan, you're paying co-pays. And every single time you pay a co-pay, they're getting applied towards your max out of pocket. So let's say, for example, you went to a specialist. Depending on the plan of the carrier, you could have a specialist visit of $35, $40, $45, or $50 copay. Every time you pay that copay, it goes towards whatever your max out of pocket is. A lot of plans, your urgent care visit is $50. You make a visit to the urgent care, you pay your $50, it goes towards your max out of pocket. Emergency room. Most plans, or a lot of plans, it's $130. That $130 goes towards your max out of pocket. Now, what Medicare Advantage plans all have in common, any preventive services, annual physical wellness visits, are covered 100% with inside of a Medicare Advantage plan. They all have that in common. And that's under the Affordable Care Act. Now, depending on the code, we'll get phone calls from clients. They'll say, well, I got this bill of $100 and I went to the doctor for an annual physical wellness visit. Now, depending on the code, if you had outside the scope of what's coded as an annual physical wellness visit, so they did a specific lab looking for something, or you made a request. If it's outside the scope of annual physical wellness visit, then there could be a cost directly associated with it. So I would just specify to your doctor, I just want my annual visit or annual physical wellness visit. So that way you're not being charged anything outside of what you should be charged for. So again, max out of pocket, the purpose is to give you a threshold, a ceiling, so that way you know, worst case scenario, this is the most I'm going to pay out of pocket. Now, my parents elected a few years ago, they're 83 and 80. They elect to go into a Medicare Advantage. Their max out of pocket is $6,000. So every time they pay a copay or have an office visit or emergency room, that copay gets applied towards that max out of pocket. So if you're talking a stroke, heart attack, cancer diagnosis of some kind, Alzheimer's, once they reach that max out of pocket of $6,000, everything then is covered 100%. Now, that is separate from any prescribed medications. So just to make clear, this is a strictly medical services rendered. Doctor's office visits, urgent care, emergency room, or hospital office visits. Now, with the Medicare Advantage, you will hear people say you can't pick and choose your doctors. Now, that would be the case if you have an HMO. So you would want to verify that your primary care doctor or specialist are in network. So that way you're not paying any additional costs that's unnecessary. But if you elect to choose a PPO gives you that flexibility of being able to pick and choose your doctors, much like a Medigap policy. That's just a lot of misinformation out there. So a PPO allows you to pick and choose your doctors. Now, a PPO has what's called an in and out of network max out of pocket. Every state is different. You go down to Florida, there's thousands of dollars in difference from a plan. You may have an in-network max out of pocket of $5,000, and your out-of-network max out of pocket could be $12,000. Here in the state of Michigan, as I'm using this presentation, your max out of pocket for just about every PPO plan is the same. So if your max out of pocket is $5,600, it's the same if you're out of network. So just want to clarify what that is. And once you meet that max out of pocket, it doesn't matter if the service is rendered, everything's covered 100%. You're able to travel throughout the United States. If it's an emergency situation, just much like your employer paid benefits, or if you have an individual policy, you're self-employed, or maybe your employer doesn't provide health insurance and you're providing that for yourself, you have the ability to have coverage outside of the state that you reside in and have that national coverage. A lot of your Medicare Advantage plans actually have a broader coverage for foreign travel. So my parents, one of the reasons why they chose the plan they have is because they still travel internationally. So for international coverage, the Medicare Advantage provides them unlimited coverage, whereas a Medigap policy, it is limited to $50,000 with a $250 deductible. But not all Medicare Advantage plans, but that is a question that we always ask. Do you travel? Where do you travel to? Is it in-state, out-of-state? Or is it any international travel? We want to make certain that if you are going to choose a Medicare Advantage, we're identifying those bullet points that are going to meet those needs in the future in the event that something were to occur. So outside of the plan being a zero monthly premium, and again, not all, but most of them are zero premium, what are the other reasons what people find attractive to a Medicare Advantage? Because people start seeing this max out of pocket. One, the Part D RX, for most Medicare Advantage plans, most all of them, it's embedded inside of the plan. So you're not paying an additional premium to actually have drug coverage. Two, you have dental insurance or level of coverage built inside of your plan. The Medigap doesn't provide any of that coverage. Three, you have vision coverage built into the plan, whereas this doesn't provide any additional benefit. You have hearing coverage. A lot of the plans will provide either a baseline, so they give you like a cap and how much they'll cover. Some plans will provide a copay. So for my parents, the plan that they have, if a lot of, it's surprising how many people will choose and purchase a hearing aid that costs $5,000 for a year. With the plan that they have, their maximum copay is $1,495. So they're going to save $3,500 in copay. Whereas with the Medigap, you have no coverage at all. They offer a free gym membership. The reason why they looked at this, the data shows that people that exercise regularly are less likely to have emergency room visits, hospitalization, or doctor's office, or less frequent doctor office visits versus someone who doesn't. So that's why they embedded the free gym membership into the Medicare Advantage, whereas the only provider that actually has the gym membership at this time is United Healthcare. And then last, you have an OTC, which stands for over-the-counter benefit. So it's a debit card that they place a dollar amount, specific dollar amount, and whether it's a monthly or quarterly benefit. Some plans also roll over the dollar amount. So for example, my parents, they have a quarterly dollar amount of $55. With that debit card, they can use it to pay that for like shampoo, conditioner, deodorant, toothpaste, bandages, cough syrup, Tylenol, Motrin, as some examples. So these are additional services that people find value with the Medicare Advantage outside of not having to pay a monthly premium. They just pay a copay as they use it. Whereas the Medigap policy doesn't provide you these additional benefits. If you wanted these are separate policies and come with a separate expense. So there's savings. So where does it make sense? Everybody's different. Everybody falls in the same column or the same box. Medigap policy, I think, makes a lot of sense for people that are aging into Medicare and have an extraordinary amount of health issues. Maybe you're doctoring for, let's say, diabetes on a regular basis. Maybe you have congestive heart failure. Maybe you have cancer. Maybe you're going into Medicare and you already have scheduled surgeries, whether it be cataracts, knee replacement, or any type of joint replacement. You have open heart surgery. I would suggest a Medigap policy. Medicare Advantage, where we find that people lean towards an advantage, are people that are very proactive and living a healthy lifestyle. So they exercise, they eat healthy, they have longevity, looking at their genes, their family history. So they say to themselves going, you know what, I'm okay with paying a copay rather than paying, $150, $170, $200 on a monthly basis. And this is going to have rate increases as you get older, as you age. And you may only go to doctors once or twice a year. You said, do I want to spend $2,000+ a year in insurance premiums when I can go into a Medicare Advantage, not pay anything, go to that annual office visit, physical wellness visit, and have it covered 100%. I'm saving a couple $1,000s I'm putting in my pocket while I'm capitalizing on the other free additional benefits I'm getting, the dental, the vision, hearing, the free gym membership. Because when you put this combined together, you're well over $1,000 a year in additional savings just by not having to pay those additional or for those additional policies. So I think this creates a lot of value. However, there are people that will say, Tyrone, I have a lot of health issues. I have cancer, I have congestive heart failure, there's other issues that you're dealing with. And you say, I can't afford $150, $170 a month in premium because I have a very limited income. Well, the Medicare Advantage would then be a viable option that would make a lot of sense, because even though you have a lot of health issues, it doesn't necessarily mean that you're going to meet that max out of pocket. And statistically, the data shows that people that choose a Medicare Advantage, less than 2.7% of them actually meet their max out of pocket. So I think there's a lot of value there. And I think there's also a lot of misinformation that puts fear into people and their hesitation going to a Medicare Advantage. And again, depending on the network you choose, also limits your ability to pick and choose your doctor. So just think of if you had employer paid benefits and your employer provided you a PPO and you had the flexibility to pick and choosing your doctors, the same rules would apply. So don't listen to a lot of the noise out there and And I would also caution you with Chat GPT. We have a lot of clients that come in, whether existing clients and or referral clients. And, after we start a conversation, then they'll slide a sheet across the desk and say, "Hey, Tyrone, here's some information that ChatGPT told me," and I'll look at it, review it, and it's actually inaccurate because there's a lot of information that doesn't provide context. And so I don't want you making a decision based on a ChatGPT. My recommendation would be talk to an agent, make sure that they're independent. I would also, someone you can meet with, whether it be a Zoom teleconference, and if you came with in person, that's great too. And then have your stuff reviewed on an annual basis. Things change, and a good agent will advise you as those changes are coming down the pipeline or the next calendar year 2027. So that's why we do reviews with all of our clients to make certain that going into the new year, what they have, what's present in their life, health, or maybe if there's a doctor change, or maybe they're anticipating moving and they want to look at what those costs look like if they're just moving to a different town or city in the state that they reside in, or maybe moving to a different state altogether. Making certain that everything lines up with what those changes are in the near future. So again, just in summary, Medicare is your primary. You get your Medigap. It's designed to work with original Medicare, so they're two separate cards. You'd be provided a third card, which would just be for your standalone drug plan. This is option number 1. Option number 2 is a Medicare Advantage. Not everybody fits in this box or column. Not everybody fits in this column, and it's okay. So at the end of the day, it's about identifying what meets your needs. It can be financially, health, and so we're just going to help kind of bring you along and help you with that process and helping you become educated so you're empowered to make an informed decision. So thank you for watching this video. Please share with friends or family, and we look forward to talking to you next time. Thank you.